I was talking about a new initiative of the WIN consortium, which is a biorepository, a tumor bank, in which we are planning to collect samples for patients who undergo surgery to remove their lung cancer. You know, lung cancer is the #1 cancer killer in the world, yet there are no good technology to detect it on an early stage. We do CAT scans, but the CAT scans are not that specific. And we do not have, as of today, we do not have any blood marker that can assist the CAT scan or complement the CAT scan to, again, early detect lung cancer. So most of the patients are diagnosed with advanced metastatic disease. We're trying to change these figures, these numbers, by identifying the blood-borne markers that are associated with early disease. So far, there have been no success. There have been several studies that looked into this matter, including the Cancer-Seek project that was published in Science earlier this year. And however, also this phenomenal project succeeded in identifying other solid tumors at an early stage, but not lung cancer. So the idea is to collect samples from patients who undergo curative surgery for the cancer, and then take a second sample that will be collected 3 months after surgery, and then conduct multiple studies and see which markers are going down after the surgery, assuming that these markers are associated with the disease, with the cancer itself. Later on, we can collect samples when the tumor recurs. And then we can also analyze these samples and see if the original marker that initially went down is now going up again to be associated with the progress in the disease. That's actually the idea. Now for this, since lung cancer is heterogeneous, there are multiple types of the disease, you would need hundreds of patients. And the only way to conduct such a trial and do it in a proper manner would be to use an organization such as WIN and use the collaboration from all academic institutions from all over the world who participate in the program. Well, we will collect for each of the individuals who undergo surgery, we will collect, in addition to the blood sample, we'll take a sample from the tumor and a sample from the tumor-free, the normal area around the tumor. So we'll be able to compare the blood parameters to the tumor parameter as well. Okay, but we want to use not archival specimens, we want to use and to collect those specimens prospectively in multiple centers. Okay, so it should be international because there are multiple changes between different groups of patients, genetic changes between countries, and so in order to make it more solid and more strong, we are trying to convince our partners from all over the world to participate in the trial. And I was happy that following my talk, talked one of the surgeons, and he complemented and supported the concept of booster to suggest that also the surgeons who actually need to invest some time and assist us in collecting those specimens are interested and they understand the significance of this question and agree to participate. This was Dr. Harvey Pass from New York. I hope, well, actually we discussed the project yesterday in the directorates meeting, and we hope to finish with all IP issues, all administrative issues, regulatory issues in a matter of 3 months. The protocol is ready to go, and in a matter of 2 or 3 months we'll be able to send it around and ask for the partners to collaborate with us. We support and develop several projects in WIN, and all of them are testing new technologies and new concepts in the management of patients with advanced metastatic disease. What we hope to do here is to decrease actually the number of patients who are diagnosed with lung cancer. So it's the idea, if we succeed, is phenomenal. Not to better control, not to let these patients live longer with a better quality of life. Rather, we hope to significantly decrease the number of patients who are diagnosed with the disease, and this will have a significant impact all over the world. That's the main significance, the main potential contribution of a booster.